Today's topic of discussion is goiter, which is commonly used in our medical science. Goiter, and I had taught in my previous class about hypothyroidism. So goiter is also associated with hypothyroid state of patient. That's why today's topic is goiter. Goiter, its literal meaning is only enlargement of thyroid gland. Enlargement of thyroid gland. It is the meaning of goiter. And this goiter is of two types. Type of goiter is, first is diffuse goiter, and second nodular goiter. Nodular goiter. And goiter is a clinical condition which is developed due to deficiency of thyroid hormones. So, enlargement of thyroid gland. Prior to this, there is a condition which develops, that is thyroid hormone deficiency. So this is a response of thyroid gland in form of goiter against deficiency of thyroid hormones. So this is the basic information about goiter. Now, type of goiter. Goiter is of two types. First is diffuse and second is nodular goiter. Now, what is diffuse goiter and what is nodular goiter? Now, diffuse goiter. Diffuse goiter is produced when firstly there is deficiency of thyroid hormones. Firstly, so precursor is deficiency of thyroid hormones, and these thyroid hormones deficiency stimulates thyroid stimulating hormone. So excessive stimulation of TSH, and this is the basic need. These 2 points makes the goiter diffuse. So excessive stimulation of TSH, and excessive stimulation of TSH causes hyperplasia of thyroid gland, and this hyperplasia produces diffuse goiter. Diffuse goiter, because goiter means enlargement of thyroid gland by any means. So here stimulation of TSH produces hyperplasia of thyroid gland. So diffuse goiter is produced by this series of actions. So this is the development of diffuse goiter. And next is nodular goiter. Now, nodular goiter. There are some differences between diffuse and nodular goiter. You can see that nodular goiter is produced due to deficiency of thyroid hormones, because this step is the first step towards formation of goiter, whether it is nodular, whether it is diffuse. So deficiency of thyroid hormones firstly, then TSH stimulation, thyroid stimulating hormone stimulates so excessive TSH stimulation. This excessive TSH stimulation gives rise to an event known as hyperplasia of cells, hyperplasia of follicular cells of thyroid gland. This hyperplasia produces firstly diffuse goiter, as we have seen, and after this repeated hyperplasia occurs. Repeated hyperplasia occurs. Hyperplasia, hyperplasia and hyperplasia. Repeated hyperplasia occurs, and not only repeated hyperplasia but also calcification is seen. Calcification is seen in follicle cells of thyroid gland, and this calcification produces fibrosis and calcification both. Next, nodular formation. Nodular formation, and that's why this goiter is known as multinodular goiter. So these are the steps which are not included in case of diffuse goiter. So diffuse goiter plus repeated hyperplasia plus fibrosis plus calcification, and this calcification is seen in some patients only. In some patients only, and before calcification there may be fibrosis. So these both events are at the same level. And in this way multinodular goiter is produced due to deficiency of thyroid hormones. So this is the first step in development of diffuse and nodular goiter both. Now next point is what is the state of thyroid secretions in goiter, whether it is diffuse or multinodular. So one thing about goiter is very important, that is it lies in all the three states of thyroid gland. It is present in euthyroid condition also, and euthyroid means normal thyroid condition may produce goiter. Second is it may produce in hypothyroid state, hypothyroidism, and also it may develop in case of hyperthyroidism. So this is a condition, enlargement of thyroid gland, which may produce by three ways. It sometimes it produced in normal thyroid gland also, in hypothyroid state and in hyperthyroid state of patient it may be seen. And now in hypothyroidism, nodular goiter may develop, and in case of hyperthyroidism, diffuse goiter produces. So these two goiters are due to hypothyroidism state and hyperthyroidism state respectively, and this normal condition of thyroid gland represents only increased demand of iodine due to certain conditions like puberty, like pregnancy, like growth, age, etc. etc. So don't be confused with hypothyroidism and euthyroid condition with goiter. It may be in all of these three stages. So now, what is difference between diffuse goiter and nodular goiter? What is the difference? Difference begins with its etiology. Difference begins with the demand of our body. So difference between diffuse and multinodular goiter. In diffuse goiter, there is etiology is Graves' disease, thyroiditis. So I am discussing here etiology, and here thyroid cancer, next gross difference between diffuse and multinodular goiter is the state of hyperplasia. Here hyperplasia is seen, while repeated hyperplasia is seen in case of multinodular goiter. So repeated hyperplasia, there is no concept of fibrosis. So fibrosis is absent, while here fibrosis is seen. So fibrosis, its appearance is symmetrical. Its appearance is asymmetrical. This is known as, diffuse goiter is known as hyperthyroid goiter, while multinodular goiter is known as hypothyroid goiter. So this is the basic difference between diffuse and multinodular goiter. Now as a whole, if you discuss the etiology of goiter, so it requires 4 to 5 points to understand about the etiology of goiter. So etiology of goiter, commonly we will see etiology of goiter. First etiology is lack of iodine. Second is genetic factors. Third is goitrogens. Goitrogens are those substances which interferes directly with formation of thyroid hormones, and Goitrogens, it is found in cabbage, cauliflower, turnip.